So in the first lecture of caries, we have studied about the definition, the causes, and also the how the demineralization and remineralization is taking place. Now we will start the next topic of caries. So let's start it. Bismillahirrahmanirrahim. We have read about that what factors are involved in that, which were biofilm, tooth habitat, diet, saliva, oral hygiene. Now we will study one by one these ethological factors. In your first year, you have in your third year, you have studied about the dental plaque and also biofilm. So basically, what is actually a plaque? Plaque is very soft, means it is the texture is very soft. Tenacious means it actually firmly flame accumulating on the surface of teeth. So it is a very sticky type of very soft or very type of material that is actually adhere on the tooth surface. Okay, so dental plaque can be also referred to the plaque biofilm. What does biofilm actually means? Bio means position and flame means a structure. So now moving towards the caries so now basically the silent features of biofilm that you should be on your fingertips. Number one, the position of the biofilm. Okay, now which bacteria is present in the biofilm, which bacteria is less in amount, which bacteria is more in the amount actually. So basically biofilm has bacteria, we all know that actually. Then it has its water and bioproducts and extracellular matrix. Okay, so basically the bacteria consist of all these in their composition. Bacteria like bacteria, of course it will be present. Then it has extracellular matrix. We will study that. You have also studied that how the matrix through the matrix they perform a lot of their functions. Now water and bioproducts. Now the it is actually highly organized and ordered sequence of events. Biofilm is highly organized actually. Okay, now basically the teeth normally have a biofilm community. Okay, so it consists of means we all know that in our oral we have actually normal oral flora. In that we have Streptococcus sanguinis and also Streptococcus metis. Okay, okay, but the difference in their proportion and various habitats within the cavity describes their pathogenicity. If these bacteria get their favorable conditions, so they become actually pathogenic actually. But we all know that the bacteria that cause most of the problems that are normal flora, because when the normal flora become get their favorable conditions, so they become pathogenic. So population and the most famous we all know as is actually mutant streptococci, which is responsible mainly for the cryogenicity and for the caries of the biofilm. Okay, mature plaque has tremendous metabolic activity. Okay, so rapid metabolism they have. Always remember of carbohydrates. So it is very important to understand that what is actually a biofilm, also that which bacteria is present, what is the composition of that actually, and how it works. So it's very important. So first of all we have studied about the composition that consists of bacteria, water, extracellular matrix, bio products. And next we have studied that it was highly organized and ordered. Okay, then we have studied that it consists of also the normal streptococcus sanguinis and metis. Then we have also said that it also consists of the mutant streptococci, which is mainly responsible for the cryogenicity. Then we have also discussed the mature plaque that consists of the metabolic potential is tremendous, and they have rapid anabolic metabolism. The next we have tooth habitats actually. In tooth habitats for cryogenic biofilm, one thing always remember it is pellicle. You have studied in your third year in perio that the first layer that is formed immediately after you do toothbrushing is actually a pellicle. Pellicle. So what is actually a pellicle actually? It is actually an organic material, the coating of an organic material that occurs immediate on the tooth surface even after when you properly clean all the organic material and bacteria. Within 2 hours, a cell-free and a structureless organic flame is formed, which is called acquired enamel pellicle. This pellicle is disorganized but biofilm is organized highly and it consists of organic material coating. Okay, so these are the stages of plaque formation, that in 30 to 1 hour after brushing there is an acquired pellicle formed. Okay, you can see the bacteria also here accumulating on that. Then these are the head of enamel rod that it is not clearly seen in the picture. Then you have cocci covering the surface in 12 to 24 hours. Then in 1 to 3 hours we have filamentous bacteria comes. Then in 1 week after we have pellocytes of cocci filamentous bacteria colony. Okay, so basically plaques are gelatinous and tenuously adherent, and they take up the closing dyes. They help in their visualization for oral hygiene, and the thick biofilm is 4 to 5. That is have great metabolic activity with sufficient nutrients available. Okay.